Canines almost always are going to get a different type of lymphoma from cats. Two completely different diseases for the most part. In dogs, what we see is very similar to human non-Hodgkin's lymphomas. So the most aggressive lymphomas that we see, and the most common one we see in the dog, is the diffuse large B-cell lymphoma. This disease is routinely fatal 99% of the time, and usually half of the dogs who are diagnosed will die within a year of diagnosis. So very aggressive disease. There are indolent lymphomas that we see in dogs, which are much less likely to cause them to die. They have much better prognosis, but they are few and far between, not the most common that we see. In cats, the majority of them are going to get a small cell GI lymphoma. And that we can manage like a chronic disease. And so cats often have survival times in the 2 to 4 year range, treated with, single agent chemotherapy, not the sort of expense or involved protocols that we see in dogs. Now, those cats who do get large cell or more aggressive high grade lymphomas are much more like dogs. And in fact, I think in many cases their disease is a bit more aggressive. It usually progresses faster with survival times in the 6 months to 9 month range compared to the year that we may see in a dog with equally aggressive therapy.